What is Gomekli? Gomekli, mirdametinib, is a prescription medicine used to treat adults and children 2 years of age and older with neurofibromatosis type 1, NF1, who have plexiform neurofibromas, PN, that cause symptoms and cannot be completely removed by surgery. It is not known if Gomekli is safe and effective in children under 2 years of age.
Ministry for me is about showing up for people in their hardest moments. I am there as the shepherd. I'm there to remind them and guide them through those hard times. I've been there, I've done that. So I know what it means to carry something heavy, invisible, and lifelong. I've lived with neurofibromatosis type 1 with plexiform neurofibromas, NF1-PN, for almost my entire life. NF1 is a genetic disorder that causes non-cancerous tumors to grow along the nerves throughout the body. I was 2.5 years old when my parents noticed a dark discoloration on my back that looked like a bruise. When it didn't go away, they took me to the doctor. Eventually, scans revealed it was a type of tumor called a plexiform neurofibroma, and I was diagnosed with NF1-PN. That was the beginning of this journey. NF1 runs in my family. My dad and grandmother both have it, but no one in the family has tumors like me. By the time I was 4, I had to have surgery to remove part of it. Later that year, I needed another surgery to remove more of that tumor because it was pressing back into my spine. We named my tumor Ralph the Runaway Mouse after one of my favorite children's books. It helped us talk about it and normalize it. He's just a part of me, so to speak. I was already learning that this condition was not going to be easy to live with. I remember being scared about a few things, but my parents were always honest with me about what was going on. Sometimes doctors would try to pull my parents out of the room, but my parents would tell them that Austin has to live with this, so he needs to be involved in the conversation. It helped me be somebody that speaks up and advocates for myself. Growing up, NF1-PN affected almost everything in my life. I could not always keep up physically with kids my age, so there was a lot of misunderstanding with coaches and teachers. I remember one time at a basketball game that I got hit hard right in my tumor and getting yelled at to get right back up when I was in excruciating pain. People don't always see what you are carrying. When I got a little older, I started talking to doctors myself. I would tell them where it hurt and what activities would make it worse. My NF1 specialist treated me like a person, not just another patient. He understood that I know my own body better than anyone and pushed me to find a treatment that worked for me. We tried several pain regulation treatments to try to manage the symptoms that my plexiforms caused. There were a few years in my early 20s when I was not on treatment. My pain was manageable. I just needed a break from all the appointments. But eventually, the pain came back. I was having spasms, and the pain was so intense at times, I could hardly move around. I decided to re-engage with care and started seeing a new doctor. That's when I learned about a clinical trial for a treatment called mirdametinib, what is now Gomekli. My doctor told me the treatment goal of Gomekli was to reduce the size of my plexiform tumors by at least 20%. When I heard that, I was just astonished. I was in. I was excited about the idea of my tumor shrinking and hoped that it would relieve some of the symptoms I had because of my tumor. Starting Gomekli was a commitment. 21 days on, 7 days off with regular MRIs, and side effects such as rashes and digestive issues. But I worked closely with my doctor to manage these. I learned what worked for me, such as staying hydrated and using baby lotion on the rash. And then after a year on Gomekli, we got the results. A 57% reduction in the size of my tumor. I was speechless. It was the first time that something has made a noticeable difference in my NF1-PN. Those results really motivated me to stay on Gomekli. This is just my experience, and everyone's experience may be different. Now, Gomekli is just part of my daily routine. I take it once in the morning and once at night. It doesn't interfere with my work or the way I want to live my life. There's something I could say to someone who is newly diagnosed with NF1-PN. Find a doctor who listens to you. Speak up, even if you're not sure that it matters. And you're not alone. Reach out to others that are living with NF1-PN. There's a whole community of us out here that understands. Ministry is about being real with people. I show up for others not in spite of my NF1-PN, but because of it. I know pain. I know frustration. On treatment with Gomekli, my tumor is smaller. I have the strength and confidence to focus on the things I love.
Important safety information. Before taking Gomekli, tell your healthcare provider about all of your medical conditions, including if you have eye problems, have heart problems, are pregnant or plan to become pregnant. Gomekli can harm your unborn baby. Females who are able to become pregnant. Your healthcare provider should check to see if you are pregnant before you begin treatment with Gomekli. Use effective birth control, contraception during treatment with Gomekli and for 6 weeks after your last dose. Tell your healthcare provider right away if you become pregnant or think you may be pregnant during treatment with Gomekli. Males with female partners who are able to become pregnant. Use effective birth control, contraception during treatment with Gomekli and for 3 months after your last dose. Tell your healthcare provider right away if your female partner becomes pregnant or thinks she may be pregnant during treatment with Gomekli. Are breastfeeding or plan to breastfeed. It is not known if Gomekli passes into your breast milk. Do not breastfeed during treatment with Gomekli and for 1 week after your last dose. Talk to your healthcare provider about the best way to feed your baby during this time. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. How should I take Gomekli? Take Gomekli exactly as your healthcare provider tells you to take it. Your healthcare provider may change your dose, temporarily stop, or permanently stop treatment with Gomekli if you develop certain side effects. Take Gomekli twice a day, about 12 hours apart for 21 days, followed by 7 days off treatment to complete a 28-day treatment cycle. Your healthcare provider will decide how many treatment cycles are right for you. Take Gomekli with or without food. Gomekli comes in 2 different dosage forms, Gomekli capsules and Gomekli tablets for oral suspension. Your healthcare provider will decide the dosage form and dose of Gomekli that is right for you. If you take Gomekli capsules, swallow each capsule whole with drinking water. If more than 1 capsule is required, swallow 1 capsule at a time. Do not open, break, or chew the capsules. If you take Gomekli tablets for oral suspension, either swallow each tablet for oral suspension whole with drinking water. If more than 1 tablet is required, swallow 1 tablet at a time. Or disperse the tablets for oral suspension in drinking water to make a liquid, suspension, before you take or give Gomekli. See the instructions for use that come with your medicine for instructions on how to prepare and take Gomekli tablets for oral suspension. If you miss a dose of Gomekli, skip the missed dose and take your next dose at your regularly scheduled time. If you vomit at any time after taking Gomekli, do not take an additional dose. Take your next dose at your regularly scheduled time. What are the possible side effects of Gomekli? Gomekli may cause serious side effects, including eye problems. Gomekli may cause eye problems that can lead to blindness. Your healthcare provider will check your vision before and during treatment with Gomekli. Tell your healthcare provider right away if you get any of the following signs or symptoms of eye problems: blurred vision, loss of vision, other changes to your vision. Heart problems. Gomekli may lower the amount of blood pumped by your heart, which is common in children during treatment with Gomekli, and can also be severe. Your healthcare provider will do tests before you start Gomekli treatment, every 3 months during your first year of treatment, and then as needed to make sure your heart is working properly. Tell your healthcare provider right away if you get any of the following signs or symptoms of heart problems: coughing or wheezing, shortness of breath, swelling of your ankles and feet, tiredness, increased heart rate. Skin problems. Skin rashes are common with Gomekli in both adults and children and can also be severe. Gomekli can also cause hair loss, alopecia. Tell your healthcare provider if you develop any of the following signs or symptoms of skin problems: flat skin rash, raised bumps on the skin bumps that look like acne, skin redness, itchy rash, peeling skin. The most common side effects of Gomekli in adults include diarrhea, nausea, muscle, joint, and bone pain, vomiting, tiredness. The most common severe abnormal blood tests in adults include an increased enzyme called creatine phosphokinase, CPK. The most common side effects of Gomekli in children include diarrhea, muscle, joint, and bone pain, stomach, abdominal pain, vomiting, headache, skin redness, swelling, or pain around the fingernails or toenails, nausea. The most common severe abnormal blood tests in children include decreased white blood cell, neutrophil counts, and increased CPK. Gomekli may cause fertility problems in females, which may affect your ability to have children. Talk to your healthcare provider if you have concerns about fertility. These are not all of the possible side effects of Gomekli. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. Please see full prescribing information, including patient information and instructions for use, available on gomekli.com.